Have you ever heard bizarre stories about objects and creatures found inside the human body? From giant worms to completely unexpected items, the world of medicine has witnessed cases so strange that they seem right out of a horror movie. On the internet, you can find records of many unbelievable situations in which even a fish ended up inside someone's lung, not to mention a plant that was growing inside another person's ear. These are the things found inside people that you are about to watch today. A video was posted on the internet by a supposed doctor who was cleaning a patient's ear, showing the moment he removed something bizarre from inside it during the procedure. During the cleaning, the doctor removed pieces of something that had been there in the patient's ear, and in the end, to the astonishment and surprise of many, we can see that it was a snake. Still a baby, but a snake nonetheless. Well, of course, the moment went viral on the internet, since it is not very common for a snake to enter someone's ear and stay there without the person being bothered or noticing. Because of these doubts, the video's authenticity was called into question. Many internet users claimed that it was either staged or faked in order to attract attention and gain engagement online, which in fact did happen. Dante Autulo, an American who was 32 years old at the time and living in Chicago, was involved in an unusual case in January of 2012. While building a shed at his home, he accidentally fired a nail gun near his head. Without realizing that a nail approximately 7 centimeters long had penetrated his skull and lodged in his brain, Autulo went on with his daily activities as normal. Only the next day, after feeling nauseous, did he seek medical attention. An X-ray revealed the presence of the nail in his brain, located just a few millimeters from critical areas responsible for motor functions. Fortunately, after a successful surgery to remove the object, Autulo recovered without significant after-effects. Trichotillomania is a disorder characterized by the uncontrollable urge to pull out one's own hair, potentially leading to the ingestion of these strands, a condition known as trichophagia. Continuous ingestion of hair can result in the formation of trichobezoars, hair masses that accumulate in the gastrointestinal tract, especially in the stomach. In more severe cases, these masses can extend into the small intestine, leading to what is called Rapunzel syndrome. This is exactly what happened to a 25-year-old woman who had to be taken to the hospital because of a buildup of hair in her stomach region, and therefore needed surgery to remove it. Patients with trichobezoars are usually young women around 20 years old who have psychiatric disorders such as trichotillomania. Associated symptoms include abdominal pain, nausea, vomiting, weight loss, and a feeling of fullness in the stomach, as mentioned earlier. In April of 2012, an incident at the University Hospital of Londrina in the state of Parana, Brazil, gained nationwide attention. During a surgery to remove a piramboia, a type of fish resembling an eel, from a patient's intestine, members of the medical team recorded the procedure without authorization. The images showed professionals laughing and using their cell phones to film the surgery. Later, the video was posted on the internet without the patient's or their family's consent, causing a major controversy. The State University of Londrina in Parana, Brazil, opened an investigation into the leak of the footage and prohibited the use of cell phones in operating rooms. It is not known how the fish ended up inside the patient, but it was certainly something so unusual that it caught even the professionals' attention. The Regional Medical Council of Parana also launched an investigation to determine whether there were ethical violations by the professionals involved, who could be suspended or punished because of the incident. Huang Yijun, a Chinese woman, went through a rare and shocking experience that left the medical world astounded by the peculiarity and complexity of her case. In 1948, at 31 years old, she became pregnant, but unfortunately the fetus did not develop correctly, resulting in an abdominal pregnancy. Due to a lack of financial resources to undergo the necessary surgery to remove the fetus, Huang went on living her normal life, despite the pregnancy loss. Amazingly, the fetus remained in her body for 6 decades, becoming a stone baby, or lithopedion, an extremely rare condition with around 300 documented cases worldwide. Only in 2009, at 92 years of age, did Huang have the mummified fetus removed from her abdomen. Lithopedion occurs when a fetus dies during abdominal pregnancy, and because it is not reabsorbed by the body, becomes encapsulated by calcified tissue, protecting the mother from infection. Cases like that of Huang Yijun highlight the resilience of the human body and the importance of access to adequate medical care to prevent serious health complications. Myiasis caused by the human botfly is a skin infestation caused by the larva of the botfly common in tropical regions of Latin America, which can develop in humans if wounds are not properly cared for. The larva enters the skin through egg laying, usually in human skin lesions, and as it grows in the area, it causes swelling, pain, and in some cases, secondary infection. Removing these larvae is crucial to prevent complications. Online, on social media, and even here on YouTube, you can find many videos showing the procedure of extracting botfly larvae performed by health professionals, who must be extremely cautious and properly equipped since they are dealing with an open wound. Therefore, meticulous hygiene and care are vital to avoid any complication. Although some find these videos informative, many people consider them unpleasant due to the rather disgusting content. After all, watching a worm being pulled out of a wound on someone's skin is certainly not very pleasant. On the television show Dr. Pimple Popper, aired by the Learning Channel, Dr. Sandra Lee treated a patient named Adam, who had 11 cysts on his scalp. On the show, you can see how large these cysts were on Adam's head and how they were affecting his life and self-esteem, as he would only leave the house wearing a cap to hide the bumps, which made him feel more comfortable. According to him, whenever he tried to go out without his cap, people would end up, even if unintentionally, staring and noticing his condition. That is why he looked for a way to live free from that problem, so he could go about his life normally. Besides, not removing the cysts at the stage they were in could lead to additional complications and after effects, making it more than just a cosmetic issue. The cysts, which looked like large protrusions, were surgically removed by Dr. Lee in a single procedure. The removal brought Adam great relief, as he could finally see his head without any lumps and without discomfort. In a notable incident that took place in Indore, India, a 12-year-old boy named Anil Barela accidentally swallowed a 9-centimeter live fish while participating in a local tradition of catching fish by hand in a river. The fish went into his respiratory tract and lodged in his left lung, causing severe breathing difficulties. Anil was rushed to Maharaja Yeshwantrao Hospital, where doctors, including Dr. Pramod Jawar and Dr. Nikhil Saxena, performed an emergency bronchoscopy to remove the fish. The case drew worldwide attention for its peculiarity and the complexity faced by the professionals, especially since nothing like it had ever happened under their care before. The surgery was successful and lasted about 45 minutes. Various media outlets covered the story, and a newspaper circulated a supposedly real X-ray image of the boy, which became famous, though it was likely just an illustration and not the actual exam image. Oral myiasis is a rare condition in which fly larvae infest the tissues of the mouth cavity. This happens when flies deposit their eggs or larvae in open wounds, necrotic tissues, or areas with compromised oral hygiene. Factors such as poor hygiene, periodontal disease, alcoholism, diabetes, and low socioeconomic status can increase the risk of this condition. A video posted and shared on the internet shows, in distressing detail, the wound and the larva clinging to the person's lower lip, which must undergo a painful procedure. The footage, taken by the professional with the patient's consent, shows one of the larvae being removed by the doctor. Needless to say, the images are far from pleasant. Symptoms of oral myiasis include pain, swelling, a sensation of movement in the affected area, and in advanced cases, destruction of oral tissues. Treatment involves, as previously mentioned, the mechanical removal of the larvae, rigorous cleansing of the affected region, and in some cases, the administration of medication to prevent secondary infection. A vaginal pessary is a medical device used to provide internal support in cases of pelvic organ prolapse or urinary incontinence. While it is an effective, less invasive option compared to surgery, inserting and removing the pessary can cause anxiety and discomfort in some patients, in addition to not being a very pleasant scene to watch, especially when the patient does not properly care for it, as was the case here. In a video shared on the internet, you can see the removal of a pessary that had been in place for about 5 years in a woman. For context, it is recommended that it be removed every 3 to 6 months to ensure the patient's vaginal health. Since it had been there for 5 years, the device ended up fragmenting, causing infection and a bad odor, and became quite unpleasant to remove. To minimize these risks, it is crucial that the use of a pessary is supervised by a healthcare professional who can advise on the appropriate frequency of removal and cleaning, as well as carry out periodic evaluations to ensure the health of vaginal tissues and the device itself, thus preventing situations like the one described. When Eli Smith, a young American girl, complained of severe pain in one ear, her mother took her to the doctor, suspecting an infection. However, they discovered something bizarre along with the daughter. Upon being examined by a general practitioner at the Shore Care Clinic in Takapuna, they proved that sometimes the truth is stranger than fiction. After all, the cause of Eli's earache was a plant growing inside her ear. Eli first noticed the symptoms when she felt a slight itch in her left ear. Whenever she moved her jaw, she felt the itch and a strange noise. But she did not think much of it until about 2 days later, when the pain became so intense that she could not lie on her left side or even open her jaw. Eli recalls that the doctor looked inside her ear and mentioned seeing something that looked like a blade of grass. He then grabbed his forceps, his magnifying glass, and pulled out a piece of grass with its bulb and seed attached. Neither Eli nor her mother nor the doctor could believe it, because it seemed so improbable that a plant could grow there, but it did. According to specialists, a tiny grass seed might have fallen into her ear, and for whatever reason, was able to sprout there until it caused enough discomfort that removal was necessary. Once the grass was removed, Eli felt immediate relief, but she ended up developing an ear infection due to fluid in the eardrum and therefore needed antibiotics. Fortunately, nothing more serious happened, and she recovered well. In 2018, a 72-year-old British man underwent surgery to remove a benign lump in the abdominal wall. And after the procedure, something bizarre and unexpected was discovered once he realized he had lost his denture. As previously mentioned, the patient used a removable partial dental prosthesis, commonly known as dentures. After the procedure, he noticed that his denture was missing, but did not connect its disappearance to any specific incident. 6 days after the surgery, the man returned to the hospital complaining of difficulty swallowing solid foods, pain while swallowing, and coughing up blood. The doctors initially diagnosed a respiratory infection and prescribed antibiotics without conducting more thorough tests. 2 days later, with persistent symptoms and a worsening condition, the patient went back to the hospital. This time, an X-ray revealed the presence of a semicircular object lodged above the vocal cords. Yes, my friends, he had swallowed his denture during the surgery. It is believed that the denture slipped into his throat during the intubation for the general anesthesia and stayed there. The patient underwent another operation to remove the prosthesis and, following the procedure, recovered completely. The case served as an example of the importance of removing dental prostheses before surgical procedures involving general anesthesia in order to avoid similar complications. Myiasis, commonly known as botfly infestation, can be triggered by fly larvae and can affect various parts of the body, including the scalp. This happens when a fly lays its eggs in wounds or lesions on the skin. After hatching, the larvae penetrate the subcutaneous tissues, causing symptoms such as pain, swelling, and a crawling sensation in the affected area. On the internet, you can find videos showing the procedure of removing larvae from the scalp. In the specific case here, the woman was in a very delicate situation, with many larvae in her scalp, and had to be sedated so that they could be extracted one by one. Well, as with other parts of the body, removing these larvae from the scalp is far from pleasant. Imagine knowing there are live larvae literally inside your head, feeding on your internal tissues. It certainly does not sound like a fun experience. A subconjunctival fat hernia is a benign condition characterized by the displacement of orbital fat through the conjunctiva, usually near the temporal corner of the eye. This occurs because of a weakening of Tennant's capsule, the membrane that separates intraocular fat from external structures. Clinically, it appears as a soft, raised mass under the eye, which can cause cosmetic discomfort and, in some cases, symptoms such as irritation or a foreign body sensation. Treatment for this condition is surgical and involves removing the excess fat that is herniated. The procedure is performed under local anesthesia, with a small incision in the affected area that allows doctors to expose and remove the protruding fat. Afterward, the eye is carefully stitched up. Images of this procedure found on the internet impress and unsettle viewers. Although the procedure is relatively simple, the idea of an eye operation can understandably be anxiety-inducing for some patients. Nonetheless, modern surgical techniques and experienced professionals help minimize discomfort, and recovery is usually quick, providing relief from symptoms and an improvement in appearance. In an unprecedented medical case, neurosurgeon Dr. Hari Priya Bandi at Canberra Hospital in Australia extracted an 8-centimeter-long live worm from the brain of a 64-year-old patient. For 3 months, the patient had experienced severe forgetfulness and depression, in addition to abdominal pain, diarrhea, and a persistent dry cough. During a brain biopsy, Dr. Bandi found the parasite, later identified as Ophidascaris robertsi, a roundworm commonly found in pythons, but never before observed in humans. The unusual case quickly went viral, spreading around the world through news channels and various media outlets. It is believed that the patient contracted the parasite by collecting herbs contaminated with python feces. After the worm was removed, she remained under continuous medical care, and there is no official information on whether she suffered any lasting effects. Avascular necrosis, also known as osteonecrosis, is a condition characterized by the death of bone tissue due to interrupted blood supply. Without adequate blood flow, the affected bone can weaken and collapse, causing intense pain and serious functional impairment in the affected area. In a video shared online by a doctor, you can see the removal of a piece of non-viable bone tissue from the upper jaw, which also affected the nose. The bone was protruding through the gum and caused the patient great discomfort, so he went to the hospital, and because of the advanced stage of his condition, he needed surgery to remove the entire area of dead tissue. Experts say that choosing the right treatment should be individualized, taking into account factors such as the patient's age, the location and extent of the necrosis, and the presence of other health issues. Early intervention is vital to prevent the disease from progressing to the stage shown in that footage. Jessie Wickham is a woman who became known for a bizarre accident she suffered at home while doing some cleaning. She was 8 months pregnant when, upon approaching a staircase, she miscalculated the distance to the railing, lost her balance, and fell on a microphone stand that was right below. On impact, the stand pierced, went through, and got stuck in her body. She had to call for help and, after some time, was finally rescued. For her to be taken into the ambulance, part of the metal rod of the stand had to be cut off, and a paramedic had to hold the metal in place so that it would not fall and injure her even more. By sheer luck, neither the baby nor any crucial organ was harmed. As a result, the baby survived, as did the mother, who suffered broken bones, cuts, and blood loss, but recovered well after undergoing surgery to remove the stand from her body. Subscribe to the channel for more videos like this.